Smallpox is an infectious disease caused by the variola virus. It is highly contagious and will spread rapidly once it enters a population. For this reason, smallpox is considered to be one of the most serious bioterrorist threats. Smallpox is extremely disfiguring, often ending in death of those infected before vaccines became available in the late 20th century. There is currently no cure for smallpox, so it is critical that people continue to be vaccinated for the disease to prevent future outbreaks. Smallpox is easily spread from contact with people who share the infection. This can include direct and prolonged face-to-face contact. It can also be spread through direct contact with infected bodily fluids. This would include sexual activities and the sharing of injectable medicines. The virus is easily transmitted through various methods. In fact, practically any contact, direct or indirect, with an infected person most often ends in contraction of the disease. A few days after being infected, red spots appear first on nearly all parts of the body. After a few more days, the lesions turn into small pustules filled with clear fluid. They appear to resemble pimple-like bumps or chickenpox. These symptoms are not limited to the outside of the body. Pustules are often found to be in mucous membranes of the throat. Finally, about a week later, the dried-out skin turns to scabs and they begin to fall off. However, because the lesions are typically deep within the surface of the skin, there is a significant amount of scarring. The first symptoms of smallpox usually go undetected for the week after being infected, but throughout the following weeks after diagnosis, incubation is advisable so that it does not spread further. Patients tend to look unhealthy, meaning that there are no obvious signs of infection or lesions on the skin. However, following the incubation period, flu-like symptoms and signs tend to occur. These include fever, overall discomfort, headache, severe fatigue, and severe back pain and vomiting. It was common knowledge that survivors of smallpox became immune to the disease, so for the lucky minority that was able to survive, they were not likely to be infected again, although the most successful and popular treatment of smallpox prior to the discovery of vaccination was inoculation. Inoculation is the insertion of, in this case, the smallpox virus under the skin. The inoculator would use a cloth wet with fresh pus from a pustule from someone who had smallpox. Then the pustules were cut into by the doctors and soaked in wet cloths. Smallpox had existed thousands of years before it entered the United States. It had been found to go as far back as ancient Egyptians. Scientists know this because they had been able to identify the disease on mummies from approximately 3 BC. By the 15th century, it was found to be passed from Portugal to Africa, so when Africans colonized Africa in the 17th century, contact was inevitable. The most vulnerable populations to receive the disease were the people that had previously not ever been in contact with it before. A great example of this is the native population of North America. In fact, some historians believe that smallpox, along with other sicknesses in Europe, reduced the indigenous population of North America by up to 90%. This is significant because it would have wiped out the population almost completely, meaning it killed more people than any battle or war of the time. As previously mentioned, smallpox is considered to be one of the most serious bioterrorist threats. For this reason, it was an obvious and efficient choice for people that wanted to wipe out native populations. Colonists of the time believed that God sent the disease down to earth so that would be able to rid the country of indigenous people. This would be in line with the idea of manifest destiny that the Europeans often promoted. To help in their agenda, the commander-in-chiefs of British forces often advocated handing out smallpox-infected blankets to his Native American foes during the French and Indian War. Skeptics argue that this mode of transmission would not have been possible, although it was written about and ordered on multiple occasions throughout this period of American history. However, it has also been argued that it can be spread via contaminated objects such as bedding or clothing.